I withdrew from high school in grade 8 at the age of 13 and went through a number of practitioners, and a number of them mentioned I should be on an SSRI. So I was taking 3, if not 4 different SSRIs. And yes, it numbed me, but I didn't feel like I was ready to thrive. And it was my most recent clinical counselor that started talking with me about things that I didn't think would be connected with our mental well-being. She started saying things like, oh, we should talk about your omega-3s or your vitamin D, get some exercise, you know the importance of sleep. And that got me looking deeper about each person's quite different about their omega-3 status, their vitamin D status, their iron status, blood sugar levels. That got me looking into becoming a different kind of healthcare practitioner.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Deiser. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to another edition of Personalized. I'm your host, Dr. David Deiser, and today I had an awesome opportunity to speak with Dr. Romi Fung, a really cool naturopathic physician from Richmond, British Columbia. Romi and I had an excellent chat, and I really hope you enjoyed today's show. Romi has a special focus in supporting those with dementia and working in cognitive health. So we had a great chat about the holistic approaches to brain health and how all of the systems of our body, thinking about how our physiology impacts our brain and how those systems can impact our cognitive well-being. So Romi's really cool in that he thinks deeply about this, but he's also an academic. Romi's completed his master's degree in aging and health from Queen's University and is currently working on the same topic, but doing his PhD from the same institution. Romi teaches traditional Chinese medicine and acupuncture at the Canadian College of Naturopathic Medicine, Boucher campus. And Romi and I have a lot in common. We love to do public speaking. Romi has this really cool circuit that he's on where he speaks to populations all over his community. So he travels around and gives talks about brain health and dementia prevention and supporting those with dementia. And I just love him for it. And I think it's a really cool aspect of what he does on a daily basis, these public talks. So I really think you'll enjoy today's episode. Thanks so much for tuning in. Enjoy my chat with Dr. Romi Fung. I'm here with Dr. Romi Fung. Dr. Fung, how are you?
Doing well, thank you. How are you, Dr. Deiser?
I'm good, thank you. I'm good. Nice to see you. Thanks so much for coming on our podcast, Personalized. We're really excited to have you.
I'm honored, and I'm looking forward to having an amazing chat with you finally.
Finally, here we go. I usually like to start with, how did you get into individualized care? How did you come to a point in your life where you wanted to practice personalized medicine? What drove you to this?
So, a couple of branches in my story coming from childhood. The first one would be that I was born with a very sensitive gag reflex. And what that means to me, and for those that don't really understand what I have to go through, is the entire time, I'm always constantly fighting the urge of not wanting to throw up. And it's not to do, well, there is some anxiety and all that involved, but growing up in my preteens and in my teens, I couldn't even put anything solid in my mouth. And probably the biggest challenge I had growing up was just putting that toothbrush into my mouth every single morning and having the uncontrollable and immediate urge of wanting to just gag on my toothbrush. And so I couldn't even swallow or stomach solid foods during that time. I had to go through more light fluids and liquids and all that. And so you can imagine going through the dentist was probably my biggest nightmare. It was.
Big time.
And seeing a number of doctors, I didn't get many answers from doctors. I've had doctors that said we could do surgery, but we don't know what to cut out. Mm-hmm. And I've heard of things like, oh, we could put you on some medication that would get you just numbing down the stomach or whatever that meant, the anesthesia and all that. And then there were some doctors that at the time I didn't think was appropriate to say, but then looking at our current studies of the vagus nerve and all that, I've also heard of doctors that mentioned, oh, do karaoke, do water gargling, and do some humming and singing. And I'm like, huh. At that point, I'm like, what are you talking about?
For sure.
But it wasn't until I got my very first acupuncture session with the acupuncturist, and that was when I was 18. And I didn't know what he was trying to go through, but he asked me a few questions about not just my digestion, but how I felt in terms of temperature and how my energy levels were, and things that weren't as related as you would think with digestion. And so I felt like I asked him more questions about, so what made me different from other patients that still have the same kind of gag reflex? And he told me things like, oh, there's something about your spleen and about your kidneys and all that. That was very different for me. So that got me into the acupuncture realm. But another branch of personalized medicine came from my battle with mental health. I grew up with a lot of anxiety and debilitating depression. That got me out of high school. I withdrew from high school in grade 8 at the age of 13 and went through a number of practitioners, psychiatrists, psychologists, clinical counselors, and a number of them mentioned I should be on an SSRI. So I was taking 3, if not 4 different SSRIs, some 2 or 3 times, 3 or more at the same time. And yes, it numbed me, but I didn't feel like I was ready to thrive.
Right.
And it was my most recent clinical counselor that started talking with me about things that I didn't think would actually benefit or that would be connected with our mental well-being. She started saying things like, oh, we should talk about your omega-3s or your vitamin D, get some exercise, the importance of sleep. And that got me looking into deeper about each person's quite different about their omega-3 status, their vitamin D status, their iron status, blood sugar levels, all that, even though it's more on the systemic level, can really greatly impact our mental health. So it was those two that got me looking into becoming a different kind of healthcare practitioner.
Wow, so interesting.
I've always wanted to be a doctor, but I never thought that my experiences would lead me into naturopathic medicine.
Definitely. And you've had lots of exposure. You had lots of exposure before going to university with the medical system. So you got to see different aspects of the system before you got to make your choice. I'm so interested by this. Who was it? What type of practitioner was it that recommended you should do karaoke for the gag reflex?
He was a medical doctor.
Amazing. I love it.
There's probably something to it that we just didn't know back then. So there was just not as much evidence about the vagus nerve and the brain-gut connection.
Right. Oh, totally. So then you went through this period of working on your mental emotional health with the clinical counselor who sounded like they had a very holistic approach to this. What was it, if you don't mind me asking, what was it that helped you feel that sense of calm and that sense of focus? What was the key to the lock for you?
I think it was that personalized nutrition, being able to look into working with dosing my omega-3s correctly as well as my vitamin D. And before I knew it, within a year, I tapered off all of my antidepressants, got back on my feet, and started high school at the age of 18. So I was a mature student by then, but I didn't think I was going to come this far just with the power of nutrition.
Yeah, right. Oh gosh, it's so interesting to me because we do that, right? Like I'm sure you do it in your practice as well with people coming in with depression and anxiety, and we're constantly thinking about what nutrients could be missing. I've got a heavy focus on objective assessments. Like I like to test the nutrients and see if there's something that, just very surprisingly could be down. Do you work with a lot of people who are experiencing depression and anxiety in your practice?
I do have a lot of people that actually followed my story. I share the same story in my social media and work with a lot of patients from the young, my youngest being 12, 13, and those that are in their middle age. We know that depression and mental health can also be a predisposition to developing cognitive impairment later down the road. So mental health is a very important foundation for everyone.
Mm-hmm. And when you're building these protocols, are you running labs? Are you doing assessments? Or are you thinking about their current diet and looking at what's missing? Or are you doing both?
Both. Absolutely both. I have to run objective testing. You can't just assume that one can control, like, for example, blood sugar regulation. That is the level of our insulin hormone. Our insulin hormone is not black and white. It's a gray area, and there is levels and different levels of insulin resistance. So I need to find out where my patients are with their level of insulin resistance to be able to balance their blood sugar levels. And frankly enough, just blood sugar level regulation alone really impacts a lot of mental health. But also to do with iron and vitamin D status and omega-3 scores, all that is personalized, and that could be quantified through blood testing. And then we work on their diet.
I don't run a ton of the the omega scores, but I did receive one this week, and I was surprised to see it. And the reason I don't run it a lot is because I feel like if you're taking omega-3s, the ratio is going to be incredibly high. And if we feel like it's indicated for the person, why not just give it? But then I had this experience this week where the person was taking omega-3s. We ran the test and it still came back low. I was like, okay, I've had this wrong. For 2 years, I've had this wrong. What has your experience been like with that test? Can you speak to that test a little bit?
Oh, absolutely. And I think that I had the same assumptions before when I started, and I thought, it might be interesting to test omega-3. Let's see where you're at. It's kind of like the same thing with vitamin D, right? We all think everyone's vitamin D is low, and we just have to supplement. But even people who supplement 1,000 IU of vitamin D is still probably tested as very low on the score.
They can be incredibly low, absolutely.
So same thing happens with the omega-3 score. I find that simply just supplementing fish oils, we typically, I think the general guideline states 1,000 milligrams of EPA and DHA combined, but I find that to be also quite low. And even in my population, my patient population to do with cognitive impairment, I supplement as high as 3 to 4 grams of omega-3s, typically DHA higher. But even for someone who's just a normal, healthy being, probably supplementing omega-3s already, I still ask if we could test them. And I find that the ratio is, quite low in terms of the actual EPA, DHA, and much higher on the arachidonic acid and, the omega-6. And it speaks volumes that it's not just one side of the coin where we think about, we're already supplementing omega-3 fish oils, that should be fine. But there's also exposure that can off-balance the omega-3 to omega-6. So things like cooking oils and oils that are used as preservatives and packaged and processed foods and all that, that would be our source of omega-6 that we're trying to off-balance here. So we're only looking at one side of the coin when we think about omega-3 supplementation. But when you test it, of course it's going to be shocking because we don't even ask or inquire about their omega-6 consumption.
And a lot of people don't know about their exposures. So people eat at restaurants a lot, right? They're not sure about it.
Exactly.
Yeah, that's an interesting point. I think I'm going to get more into using that test because I think the power of omega-3s is present and something we should be tapping into a little more. Do you think I'm offside having a concern about 4 grams of omega-3 and arrhythmia? Do you think there is something to be worried about there?
Yeah, so I think we had some new evidence just in the past half year to maybe even 1 year about the risk of arrhythmias and fish oil supplementation. And it is valid that there could be some connection right there. And that's only one side as well. And when we think about arrhythmias, we have to think about mitochondrial function. We have to think about magnesium content. We have to think about even iron content. So I think that it's all about balance. And I think when we test for omega-3 and testing high or supplementing high with omega-3, that we also have to be mindful about the balance between that and magnesium and CoQ10 and iron and all that. So I think we're only seeing it from one lens with that kind of study. It's valid that we should be careful about supplementing high with omega-3s. But I think for the point about risk and risk factors, it is on the lower side with omega-3 fish oil supplementation.
We need to have someone do the omega quant and repeat that same study and look for
Yeah.
if it's just exposure or if it's actually related to the stored levels that a person has or the
Absolutely.
levels of free circulation. I think that would be so interesting. Now, your expertise is in brain health. Can you tell us a little bit about your practice? Tell what's your day like? What's your focus? What type of person are you supporting mostly?
So my patient population, I work with patients living with dementia, as well as those wanting to optimize their brain health. So looking into mitigation of dementia risk. And my approach with my patients is quite unique in that I don't define the patient as having dementia. Of course, there's the clinical diagnosis and such, but it's about taking a step back. And this is why, personalized medicine is so important in this realm here, is that it's not just something causes dementia, but at least 36 different contributing factors can contribute to the development of beta amyloid plaque and tau tangles, which are the hallmarks of Alzheimer's disease. And these things range from inflammation to iron levels, vitamin D levels, blood sugar regulation, and all that. And that means that no two people with dementia are actually the same. And so as I screen my patients, and the same thing goes for dementia prevention screening, I love screening patients in their 40s, 50s, and 60s, even though they may not have symptoms of cognitive decline or short-term memory loss. They may have family members or family history of developing dementia and or Alzheimer's disease. And we find so many things that could contribute to the development of dementia as early as decades prior to actually developing those kind of symptoms. So screening is an important part of my practice, and I think it's a growing factor in not just the naturopathic field and the naturopathic realm, but also in the conventional side of things.
Can I stop you there? Because I have a really close person to me who has dementia in their family. And I'm interested in if you have a stepwise process, if you have an order of important assessments or questionnaires that you would use for someone, say, who's in their 30s or 40s, who has a family history of dementia. What is the screening process like for you?
For me, well, you've put two things there, so I'm going to go one at a time. First off, biochemical. So I make sure that we test for biochemical factors, blood testing, urine testing, and all that. The first three things I'm always establishing in all of my patients, regardless of if they're looking for dementia prevention or dementia care, is I kind of use the analogy of kind of like a highway to the brain. And you have to have the brain being well fed. If you look back into Science 10 and think of just even the cell, we have the cell that has the organelles, the nucleus, the mitochondria, the endoplasmic reticulum and all that. I hope that's not giving us any PTSD at this point with high school. But every cell needs three major components, and that is oxygen, fluid, and fuel. If those three factors are not met, then the cell's not going to be able to make ATP, and it's not going to thrive. It's going to go into programmed cell death. And I say that to all of my patients and to everyone, including doctors, is that those three factors need to be established in the brain. So what do I mean by that? First off, getting enough blood to the brain. Blood flow is going to be so important to the brain, and we lose optimal blood flow by many of the following: physical inactivity, lack of sleep, lack of movement, but even cardiovascular health is so important because as our blood vessels start to deteriorate due to physical inactivity and potentially our diet and our lifestyle and all that, it's going to become even more stiff. And if it becomes more stiff, then it's not going to be able to bring blood further, distally, to the brain and to our extremities. And so if that blood cannot be distributed properly to the brain's not going to get the fluid and the blood and potentially what's in the fluid, which is the fuel and the oxygen that it needs. But a second prong to this is the idea of building more red blood cells and building more blood vessels, angiogenesis and all that. We have the ability to make new blood vessels. And that has to also be fueled, with proper nutrition and proper stimulus. So that's the blood part that we need to get. And there are ways to get more blood flowing to the brain from physical activity to HBOT to certain herbs like ginkgo and all that. There's a big study that it shows that ginkgo is really helpful for cognitive impairment only if it really is this blood component that it's lacking. Then there's oxygen. And oxygen, we need oxygen for everything. We need it for respiration, cellular respiration right there. So every cell needs oxygen to be able to make its own energy and to be able to live. When we think about oxygen, or when I think about oxygen, I think about the carrier of oxygen in the blood, hemoglobin in the red blood cells. So you want to know if we have enough iron in the body and if we have enough hemoglobin that is currently in the body, and we can test that through ferritin, through our iron panel, and through our CBC. So if we're starting to get anemia, that could also contribute to what can mimic cognitive impairment, but when corrected, can actually lift a lot of that brain fog that many of us start to see just by having a lack of oxygen. But also in the older adult population, you have to think about how we get oxygen, and that's through our respiratory system. So if there's a chronic respiratory disease, COPD, chronic obstructive pulmonary disease, or that sort of thing, or asthma even, that could be something that we have to work with in order for the body to obtain more oxygen stores or the ability to breathe. And even deep breathing is now something that is a trend in getting more oxygen to the brain. But also sleep apnea. That's a very big factor that needs to be screened and can be actually seen on a blood test. I kid you not, Dr. Deiser, that I find a lot of, there's this one test in the CBC called RDW, red blood cell distribution width, which tells us the variation of red blood cells. And that the higher variation we have, the more the body's trying to make more red blood cells to be able to carry more oxygen. That's already the first sign that can be screened as a matter of anemia or even sleep apnea. And I'm starting this conversation.
Oh, that's interesting. I never heard of that before.
I typically have to start that conversation with the patient saying, I'm starting to see that your RDW is getting high, and that gets me asking them, do you snore? They may or may not. We don't know. Mm-hmm. But even getting a proper sleep study would be, very indicated in this case. Mm-hmm. So that's the first part of making sure that the brain is getting what it needs. Third is fuel. And to be able to get fuel, most of the brain, not all, but most of the brain is in tune with having glucose as its fuel. And in order to get glucose, that's coming from our diet. But sometimes that fuel doesn't get there in the first place. And the most common factor that I find is number one for cognitive impairment is insulin resistance. There's a part of the brain that encodes our short-term memory, and that's the hippocampus. And it's the hippocampus that has the densest amount of insulin receptors, meaning that part of the brain requires more fuel than anything. And if you think about it, one of the most common symptoms of dementia, or the common progression of dementia, is short-term memory loss. Could this be the link right here? And now we're even establishing Alzheimer's as type 3 diabetes, potentially because of this link.
Wow, interesting. Okay, so it's the receptors in the hippocampus. Okay, cool. I knew that obesity was associated with dementia and that blood sugar control was important, but I didn't know that mechanism. Oh, that's so interesting.
So yeah, working with all three of those factors, blood flow, oxygen, and fuel.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Okay, before you go to screening, I need to stop you. Before you go to screening, you have to tell me about blood flow. Because I have a really interesting thing, because I'm measuring blood flow to the muscles, right? I'm doing smooth muscle or skeletal muscle oxygenation assessments. It's called a MOXIE test in the office. And we use it for people who are athletes, trying to become fitter, trying to find out where their anaerobic threshold is. But we also use it in chronic fatigue syndrome when we're looking at if someone has a resting oxygen level in the muscle that's adequate to supply the tissues with enough resource for oxidative phosphorylation, for aerobic capacity. So we use it in chronic fatigue because that's a really cool application. It's being studied for that now. But I'm wondering about if you're assessing for blood flow and oxygenation to the brain, or are you just promoting everyone, okay, here's the level of exercise that we need to be doing, right? Like, here are the things that we could be doing to increase oxygenation. You know, everybody who comes in should get this level of HBOT, for example. Do you have an assessment, or you just have a protocol that you use?
I feel like we need to work together in this, Dr. Dizer. I would love to see more of your work about the oxygenation. At this time, we don't have access to that kind of screening. But if you look into Dr. Daniel Amen's work, he utilizes something called a SPECT scan. And that shows a brain scan of how much and which parts of the brain is more oxygenated and how each part of the brain has what kind of blood flow is there. So if we can get access to that kind of SPECT scan in Canada, I think that would make us, that puts us years ahead of being able to screen for this.
We don't have that in British Columbia, do we?
I think we may have some of the scans, but it's not accessible at this point. Okay. That's our limitation here.
That's our limitation, sure. But, there's a minimum effective dose of exercise that we can use in dementia prevention, right? And in treatment as well can be incredibly supportive. But the insulin resistant piece, I'm interested to know about your strategies for optimizing for insulin sensitivity. Can you tell me, before we get into screening, can you tell me a little bit about how you would help someone who maybe has a HOMA-IR of 3 or 4, maybe even up to 5, or has an A1C, say, of 6.4, 6.5? Well, how would you approach this?
I'm glad that you brought up the HOMA-IR because testing is very important. We have to test for this first. And I've seen HOMA-IR as high as 12 to 14 in my practice.
Okay.
And
very high.
Very high. So first off, if it gets, the higher it is, I tend to start with supplementation. And supplementation, 2 of my very favorite supplements to mitigate this would be berberine and resveratrol. And the reason why I prefer this combination right here is because berberine and resveratrol, epigenetically speaking, tackles the SIRT1, the SIRT2 and the AMPK pathways, which is also the same pathways that one would go for in terms of anti-aging. So is insulin resistance actually aging? And that's another question that we have to dive into. But once I test, I will treat with berberine and resveratrol. I look into making sure that they're not bringing their resistance even higher. So making sure that, each meal, I'm not going very detailed with one's diet only because it's already a lot on their plate, no pun intended. But the point here is making sure that we're incorporating enough protein, enough fat, enough fiber to prevent any of those blood sugar spikes and dips that could contribute further to the insulin resistance. So making sure that in coaching language, having about 1 to 2 servings, or like a deck of cards size, a deck of cards is 1 serving. So having about 1 to 2 servings of protein per meal, ideally first, if they aren't doing it in the first place, because a lot of us are more carb heavy now with our diets, and it's probably the easiest way to be able to fill us up in our current situation. On top of that, exercise, getting resistance exercise more so than the aerobic. So more anaerobic than aerobic. I like the combination, but by training the muscles, whether that be through body weight exercises, resistance bands, free weights, or machines, what you're doing is that you're actually opening up something called the GLUT4 pathways in the muscles, which, open up without having the use of insulin with exercise. And that combination of exercise, supplements, diet, and lastly, sleep. If sleep is a factor, we need you to be sleeping, and there are many ways that we can help with sleeping, but there's evidence now that shows that even having 1 all-nighter for the students and the medical students out there, that your insulin can become very similar to what would be resistant in a diabetic, even if it means it was a transient amount of time. And that's already scary to think about that, if you recall your medical school days.
I remember. I remember I'm going through something like that right now, and I'm trying not to stay up all night very frequently. But yeah, that can be incredibly dangerous. There's a lot to unpack there, so I'd like to take it step by step and sort of just peel away the layers, because I think it's important for our listeners, who are mostly practitioners, by the way, so that they probably be interested in how you're approaching this, considering your expertise. But I know that someone I greatly respect in this realm is named Dr. Bredesen. He likes the keto flex approach, where he'll be very specific about diet. It sounds like you've got a strategy to slow gastric emptying, but do you ever take people into the ketogenic diet or into a flex type diet, or even use a fasting protocol, for example?
No, absolutely. And that depends on the patient. Now, I am also trained by Dr. Dale Bredesen. I have done the RECODE 2.0
I know.
protocol right there. And it's almost 50-50 for me. And the reason why I'm saying that is because a number of my patients that are seeking my consultation, my expertise in cognitive decline, they're actually underweight versus being overweight. And for someone who is underweight, having to do either intermittent fasting or the ketogenic diet, which may actually be contraindicated in this case. So it's very, very difficult and challenging for them to be on such a restrictive diet that when in fact it might be in better terms for them to actually gain a bit more lean body mass first and foremost. But the evidence is there that doing intermittent fasting definitely really increases your insulin sensitivity. You're resting the insulin receptors. And even the ketogenic diet, what I love about the ketogenic diet is that when your body starts creating these ketone bodies, then that could bypass the insulin receptors that are already resistant in the first place. That's why a lot of cognitive impaired patients can actually benefit from that, and they actually see the benefits immediately. But the only thing about it is it's quite the challenging diet. It's not sustainable. And I find that it could help with the cognition as we build the insulin sensitivity once more as much as we can. So I love the idea of the ketogenic and the insulin, the fasting, intermittent fasting diets, and even the keto flex that Dr. Dale Bredesen has brought up, where you're fasting for, usually it's the, what do we have here? For women, usually 12-12, and then if not 16-8. 16-8 tends to be the most common, and if you want to go even further, then 24. That tends to be the next common path right there, and using mostly a kind of a flex, almost more so like a paleo-esque, but with intermittent fasting kind of diet there.
I worry about it. I worry about the ketones not coming up high enough to feel something. You know, so this spot where you're sort of like between low carb and keto, I've done that before, and for me, it causes me significant fatigue, and that fatigue turns into something like brain fog, which is quite uncomfortable. However, I have reached a spot where my ketones have been high, but for me, it takes quite a while. Like, it takes at least a week. Then they become normal, and it feels great, but I can't sustain it. It's just not a diet that I could do. My kids don't like the smell of fish, so it's impossible to maintain because they're just mad at me all the time. But for someone who's already going through with memory loss, I think it could be so incredibly difficult to sustain a diet like that and to struggle through a phase where maybe they feel terrible because they're not making enough ketones and not eating enough carbs to actually have energy in the brain.
Exactly. There's also another level that we don't necessarily take as well, and I didn't actually get into this until my graduate studies, but the ideal of frailty, and to put a older adult and put them in either a keto flex diet or intermittent fasting or ketogenic diet, if they're already frail enough, it's already hard as it is. If their cognition has already declined to a significant amount, how are they preparing the foods? Who's preparing the foods? Whoever's the caregiver might also go through quite a bit of the caregiver distress and all that.
No, definitely. To that point, could we speak a little bit about muscle, or a little more about muscle? I know you brought it up already. How are you integrating programs for people who are insulin resistant, for example, who need to put on a little bit of muscle? What is there an approach that you take to get them in a muscle building zone, whether it be through strength training or otherwise? How do you make those decisions?
Well, first off, it's based on their mobility first. You're going to have patients coming in ranging from those that are in wheelchairs to those that may be limited in mobility. and those who are more mobile. So you have to gauge into that because resistance exercise, I would say, is the best as much as possible. And those with even some ability to be mobile, being able to walk and sit and all that, I tried to ask if we could look into doing something. Of course, maybe a best way is to get a personal trainer as well. But my description for them is, could you try standing from sitting on your chair and doing, reps from there, building the quadriceps and building, the glutes and the hamstrings right there first and foremost. That tends to be the, I wouldn't say easiest way, but the biggest way that you can build some lean mass first and foremost. Now, for those that are limited in mobility, especially if they're in a wheelchair, then building their back would be a big component. And there are installments you can do either at the home, or I'm pretty sure there's gyms and community centers that will have this, or even the nursing homes too. I know they have the wall stands for those that have to grab onto. If you just bring the wheelchair just closer there and have your loved one or the patient living with dementia to grab on and almost do like a row with it. You're already engaging the back muscles as much as possible. So looking into personal trainers and even occupational therapists would also be very beneficial in this case.
Yeah, I love that. That's a really good point. Like starting with the leg muscles, because they're such big disposal areas for glucose compared to the rest of the body. But the back, we see very quickly diminishing when someone is immobile. It's something that people lose out on. It's much easier when you're immobile to be doing pushes rather than pulls, I find. So that's a good note as well. We have some bands. I went on and I bought 100 bags of bands and put my name on them.
Yeah.
And said, here's some exercise bands. And we brought them into the clinic. Now we just give them out for free because no one needs to buy bands, but everyone needs a pair of bands at home. So we give them out to people and we, wrap this around the chair, have someone wrap it around the chair or whatever, and just start pulling it and just start rowing that. And it makes it quite easy for them.
I think we need to make a goodie bag together because I have I don't really have the bands, but I have something for the brain.
What do you have for the bag?
I could put this in a little goodie bag right here, and that's a little puzzle right here with my name
There you go.
on
Oh,
it.
perfect.
And it's a puzzle every single day.
Nice. Oh, that's super smart.
So that works the brain right there.
I love that. That's really smart. Well, okay, so that's a pretty good review of insulin resistance. Let's dive into your screening process. I know in my practice, I'm quite minimal in my approach in this area. I use the Montreal Cognitive Exam because that's what I learned from reading Dr. Bredesen's book and researching online how to assess someone initially and track the progress. Is there a series of screening events that you have or tools that you use that you'd like to share?
The Montreal Cognitive Assessment, MoCA, is the most sensitive test that you can do with your patients. And I would say that probably would be gold standard when it comes to cognitive assessment. The only con to it is that it does take a bit of time. Usually it does take about 20, if not 30 minutes. And depending on your patient population, if they struggle a lot with it, up to 40 minutes to just even conduct one MoCA testing. But I do the MoCA test in my practice, and also being certified by MoCA, there are many options and versions now with the MoCA testing. And I think they're developing the MoCA test to be done that you can do on your tablet.
They have the iPad version, yeah.
Yeah, the iPad version.
And we have that in the office here now.
Perfect. And that could be very accessible for those that don't have close access to a naturopathic doctor like us there. So when I screen, I typically take 2 hours to screen my patients. So a new patient has to come in for 2 hours minimum. The first hour, I get the history. And of course, usually by the time they've progressed this far, they're coming in with a family member. So there is another questionnaire that I use for the caregiver, and that is called the Alzheimer's Quiz 21, the AQ 21. And that gives me a better understanding as to how they're going through their daily lifestyle. Because in order for one to be defined as having dementia, their activities of daily living have to be impacted. And I think another formal definition of dementia is that 2 of the 6 cognitive domains are significantly impacted. So from focus, short-term memory, executive function, all that. So If two of those six domains are impacted, that's when we can define them as someone living with dementia. Going through a number of factors in their lifestyle. So besides the AQ21, which gives me a better understanding as to are they forgetting their keys and wallet, their small things, are they forgetting names, are they forgetting ways to conduct their own daily living. So that's what the AQ21 does. Then I'm screening for a number of other things too, such as infections. Because having a history of infections, a UTI can actually exacerbate or even mimic someone with cognitive impairment. Looking into the home and the environment, because looking into water damage and mold, that's also very important too. That's very overlooked in these kind of populations. Looking into patterns of cognition. So if one is experiencing some cognitive difficulties or cognitive impairments, but it's only by hour, or maybe on a good day or a good chunk of day, then you're probably looking at a TIA, which is quite intriguing that you would think it's a steady decline, a progression of your declining of cognition. But in fact, if you had some good days and some bad days, or good hours and some bad hours, that's actually probably a microstroke or a TIA that needs to be really ruled out. And then I look into, of course, medications. A lot of combinations of medications can actually be impacting their cognition. And without screening for interactions and all that, that can be a very important part that is overlooked by the conventional side. And even not just interactions, but depletions, nutrient depletions. So CoQ10, B12 tends to be the very common ones.
Right. Well, that's incredibly comprehensive. Are you doing the dipsticks in your office for the urine assessments?
I'm trying to implement that ASAP. I've just gone to this new practice and
nice.
hoping to get into that. Yes.
For sure. Yeah, I think it's absolutely relevant. I'm interested in this functional approach to screening, where you're thinking about mold exposures, for example, and maybe other environmental aspects of living that could impact the brain. How do you make decisions for when to assess for other factors, environmental factors, whether it be, say, mold exposure, for example, or heavy metal exposure, or some type of environmental toxin that could impact the brain?
So some of the more common things right there would be onset and kind of the development of these symptoms. If it was a very long onset, it was a gradual chronic onset, and it's later in life, you could look more so into the biochemical factors. But if it was a kind of like an acute onset and it's early on in their lifespan, so like in their mid to early 50s, maybe even early 60s, I'm looking or suspecting more of the mold exposure or even heavy metals in this point. And of course, I'm still screening and ruling out anything to do with cardiovascular health and all that. But it could also be the onset of sleep apnea. And onset of sleep apnea, of course, getting a sleep study done is important. What I believe now is even more important for those living with sleep apnea is getting properly screened by a dentist.
Okay.
And the reason why I'm saying dentist is because there are a number of dentists, and from where we're at in the Lower Mainland, there are a couple of dentists that actually do the full screening of the airways and the throat and can actually determine if it really is a obstructive nature, rather than measuring for lack of oxygen, with the SpO2, oxygen saturation. So dentists, I feel, are better equipped at this. And there are some dentists out there that are trained to produce, I forgot what it's called, but it reminds you of a retaining device that you put as a retainer overnight, and it kind of opens up your palate depending on the shape of your airway cavity and your mouth. And that could at least increase the amount of pressure going in, and that could be used in conjunction with a CPAP machine.
Oh, that's very interesting. Yeah, sleep is so important for brain function. On that note, on the airway note, I wanted to mention that we use a spiral bank here for FEV1 and FVC. So we're doing assessments for lung efficiency and lung capacity, and we try to do that when people are suffering from memory loss, to see if there's something happening at the lung level. But the sleep level, I haven't considered this deeply. I wish I had access or a referral note for sleep studies. I've never actually sent someone for a sleep study. Do you have someone that you refer to for sleep studies?
I have a couple of places in Richmond that we've gone to connect. And if not, I would refer my patients to their medical doctor to get the referral themselves. And sometimes I would have to just write a note or something to inform them that this is what I'm seeing. RDW is high, and I am suspecting sleep apnea that we need to screen.
Excellent. How are you screening for TIA?
How am I screening for TIA? That's a good question, and that's something I have yet to really finalize at this point. Of course, we all know what a stroke looks like, first and foremost. If that is really happening, then we know the 4 signs, the FAST acronym. But if it really was a TIA, in most cases, I'm finding that if I'm suspecting changes that don't seem normal in terms of the progression of cognitive impairment, I would get them to get referred by their medical doctor to get a brain scan done, CT scan or MRI. And usually they are the ones that find the TIA, and then we just work accordingly.
We have referral capacity for those exams now, but the costs are very, very high to pay privately. Unfortunately, I've been able to connect with an imaging facility, so I can refer for those. My gosh, it's an arm and a leg to have them done. I have an interesting note about that. I've had communication with the Prenuvo scan, the full body MRI assessment, and we've had many patients go and do this scan, and on that scan, they very often find areas of ischemia. They do. And they say, well, it's normal to have 1 per decade. And the people who, when they hear that, they're very much freaked out by that. And I don't blame them at all. To know that there are areas where the blood flow is lacking because of an ischemic area, which was likely one single event or some version of smaller events that led to this. But any comments on that 1 area per decade present on brain MRIs being considered normal?
I think it's a matter of, if you're screening that, it's about being proactive too, which I don't know how the post-care was for that, and if a conventional practitioner could comment that as well. But yeah, to think that our lifestyles now, which can deeply mitigate the risk of creating these ischemic attacks, having 1 is probably 1 too much, in my opinion, right there. And there's many ways that we look at it, not just from the imaging point of view, but even from our cholesterol panels and such, that tends to be dismissed. We look at triglycerides. I think that's also a very important factor over cholesterol.
Absolutely. Yeah, so having this prevention approach, looking forward, here's what we need to do. We need no more of these, 100% no more of these. I'm inspired by you staying with education and continuing to press with your foot on the gas to become a leader academically in our profession. And I know right now you're working on your PhD. Can you tell us a little bit about what you're studying, what you've studied so far when you did your master's program, and what you're looking forward to studying through the course of this program?
Absolutely. First off, I graduated from CCNM in 2016. And as I started working with my patients, especially with the older adult population, I felt I wasn't grasping kind of like their realm as much. And that got me looking into pursuing the Masters of Science in Aging and Health. And from there, not only have I gotten more, a bigger understanding about aging theories, and I love the idea of looking at aging theories and putting it together. That's the basis of personalized medicine right there. Because the way we age, there's so many different factors, from inflammation, from stressors, from lack of nutrition, from oxidative stress and all that. There's so many theories out there. But I found that I was someone that learned so well by putting things together. And by putting these theories together, I thought there's something about this part of aging theories that I wanted to dive further. And given the opportunity, I was asked to pursue a PhD in aging and health by my professor at the time, now supervisor, Dr. Kevin Wu. And I went for it. I did my PhD comprehensive exam, and I'm currently a PhD candidate now as I passed the comprehensive exam. I did the comprehensive exam on a topic that I was given to do with the COVID-19 lockdown measures and the social isolation and loneliness that was impacted on these older adults living in these residential homes and how it impacted their physical, mental, and emotional and cognitive health. And that got me really thinking more about the older adult population as a whole. And now I'm looking into pursuing my thesis, my dissertation in dementia screening. And I've done a total 180. So those that want to pursue a PhD, you don't have to always go forward into your topic. You can change your topics whenever. And I found that just recently, I've become much more passionate about dementia screening and how if we can screen for our patients, whether that be a medical doctor, nurse practitioner, naturopathic physician, we can take measures as early as possible. And there's so many factors, so much research that's growing out there that has to do with mitigating the risk of cognitive decline. And taking an early stance on that is a powerful move. So I'm hopeful that with my dissertation,
Wow, exciting.
that starts more conversation with doctors on getting their patients to be screened more effectively and more efficiently.
I don't want to ask you or speculate about what your thesis might be.
Wait till it comes out.
I will wait till it comes out, but I have to ask you some questions.
Yes, absolutely.
About how you feel about things and what you think about things. Because personally, I think it's incredibly valuable to know your ApoE status at a young age. And I'm wondering if you agree with that, and if not, why?
I love testing for ApoE as well. And I test a number of my patients who haven't been tested yet for ApoE to get them tested. Or I have patients that come in saying, I already know my ApoE status and I want to work with it. And I have a number of patients that have the ApoE 4/4, which is the highest risk. So testing for ApoE, which is just a measure of how well our body works with cholesterol and lipids, specifically in the body and also in the brain, can impact our ability to produce beta amyloid plaque. And by knowing your level, we can take measures as to how we can mitigate that. And because it's a gene, ApoE is just the gene that we're testing, there's the level of epigenetics that there are factors that can downregulate this ApoE gene epigenetically from the basics such as B vitamins. Having a very bioactive B complex is very important in getting that. Making sure that the ratio of saturated fat is reduced, but still having some level of monounsaturated or polyunsaturated fat to be able to develop your brain and to work with your health and your cardiovascular health. So there are many things that can be talked about once we know your ApoE status.
So you're a fan.
Yes.
I'm a fan too. And a lot of people get worried, right, when they hear their number and they know the risk at that point. But I think it can be quite empowering, right? Because then we take all the other screening factors that you discussed and we put it into a package and take them all very, very seriously. And you can move forward in an empowered way.
And knowledge is also powerful because what happens if you don't know the ApoE status and you then start doing a ketogenic diet, which may not be the most indicated in this case? You could actually be harming your risk of developing decline rather than mitigating it.
Yeah, really good example. A big part of this show and this journey we're going on is inspiring the profession and inspiring the young grads. I know that you're a professor and you're teaching young grads or young students. I'm interested to know what you share with them about how you've gotten to where you are in your career and how they can reach a spot where they can help the most people possible. So what would you say to your younger self if you were just graduating today? What would you tell yourself to help yourself stay motivated and really thrive in those first few years?
Well, I have to say the biggest part for me was influence. And if I was to tell myself 5 years ago when I first started, I would say get yourself and get others to think the way that the body is working. So what I mean is don't be fixated on the diagnosis or the label. Step back and look at it from a different perspective, a different systemic kind of lens. Because I know that the first few patients that come in, And I was one of those. When I first started, I had 12 patients, a dozen patients coming in, all wanting to have me work on their hot flashes for postmenopausal symptom. And I'm like, I think I better change my focus now. I better go into women's health. But I was overwhelmed at the time because I was just so focused on what can I do for the hot flashes when I had to just simply step back. And if I were to go back to where I was then, not saying that I was not successful with working with them, but to understand the processes of how imbalances in hormones and how that is contributed by potential diets, lifestyles, and all that, just seeing it from a different lens tends to be very more empowering. And I felt more comfortable, even right now, I feel more comfortable looking at this kind of lens than to be very fixated on the diagnosis. And I feel that if we can start looking at that, I mean, that's a major tenet of naturopathic medicine, treating the root cause.
That's what I was going to say. You're describing one of our principles. I love it. Yes, I don't have the principles on the wall, but they're on the wall in my mind. So I have to sometimes you just have to review them, and it really grounds you and helps you provide the best possible care for the person in front of you.
Absolutely. And if I can give just one more advice for our new grads is everyone's going to be quite different. But what I found for myself is to use my authentic voice. And people want to hear, people want answers. People want to find us, but they can't find us if we're not visible. And so I know we don't really get much of a marketing education per se. And we would think that coming out of the school, we're doctors first and foremost. Yes. And we don't want to appear to be salesy or salesman-like. But people want to find you, and in order to do that, you have to be visible yourself. So set up even like the Google website, etc., just to be sure that you're starting to be found, but to get yourself heard. And I feel my biggest success came from the talks and looking back at my 5 years ago self, that I could have pushed even more to get to bigger populations, such as the city hall and find that, or even ask yourself first, what's your ideal population? Then go to those kind of locations that have your ideal population and go from there.
Absolutely. That's great advice. That's great advice. The wisdom from Dr. Fung. I love it. Thanks so much for sharing everything about your journey and your current practice. It was such a joy to talk with you today. I got so much out of this, from the screening techniques to the inspiring words that you had for new grads. I really appreciate your time. And I'd love to hear, where can we connect with you? Where can we find you online?
Well, first off, thank you so much again, Dr. Daiser, for having me. It's an honor. So people can find me on my website, www.drromifungnd.com, or probably the easiest way nowadays is Google, by Googling Dr. Romi Fung. You can also find me on social media, so Facebook, Instagram, at Dr. Romi Fung ND, as well as YouTube as well, where I do a number of mini educations and other recordings.
Excellent. Thanks so much for sharing. We'll be sure to connect with you online. Hope you have a great day, and thanks again.
You take care, Dr. Daiser.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Daiser and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.